Hey guys, I want to thank you all so much for the support I have received since the soft launch of the Canine Applied Anatomy Series earlier this week. The Canine Applied Anatomy Series will be available for purchase through the learning management system of the Veterinary Academy of Higher Learning. We are aiming for an end of May release. For all you eager beavers out there, there's definitely going to be a special promotion, so to register your interest, send me a message on Facebook or leave a comment on the post below. Following up on the Applied Anatomy lecture, I have put together another video for you to show you how to assess range of motion and end feel when performing an examination on your patients. These doggies are rehab patients at the Soy Dog Foundation Hospital in Phuket, Thailand. Okay, so in this lecture, we will be assessing range of motion and end feel when performing a clinical examination on our patients. I have 3 clinical cases here for you that we're going to have a look at together. Traditionally, in our clinical examination, we look for abnormalities in joint range of motion to alert us to an underlying pathology. In some cases, the flexion and extension angle of a joint may be reduced. In other cases, it may be increased. Identifying an abnormality in joint angle is the first step. Now, taking it one step further, we need to feel into our examination to identify what component of the musculoskeletal system is limiting the range of motion. Tell me, Dr. Priya, why is this important, you may ask? Well, it is important because the cause of limitation of range of motion will determine how I approach the restoration of normal range of motion. In some cases, it will also determine whether restoration of normal range of motion is possible or not. So if the limitation of range of motion is caused by end-stage osteoarthritis and bone remodeling, it would not be possible to restore the range of motion of a joint. However, if the range of motion is limited by soft tissue tension or joint capsule stiffness, with intensive rehab, we have a chance at restoring the range of motion of that particular joint. Our first patient here is an old dog called Black Ninja who was hit by a car and came into the Soy Dog Foundation Hospital with hind limb lameness and paresis. Now, regardless of what mobility issue your patient presents with, it is absolutely essential to perform a full clinical examination. In this video, we have edited out the examination of the hind limb, and the examination of the forelimb only focuses on assessing range of motion. So let's have a look at this video now. Taking the carpus into full flexion and extension. I'm going to pause the video there for a while. So in full carpal flexion, the paw of the animal should be able to meet the antebrachium, which means you can literally fold the carpus in half. In full extension, the carpus can move into 10 to 20 degrees in hyperextension, and this is considered normal. So we go ahead and watch the video, palpating up the radius and the ulna, just looking for pain. Now we flex the elbow joint, and here I cheat a little. I take the elbow and the shoulder into full extension, which is not a problem for this dog. Flex the shoulder. I'm just going to pause the video again. So just a reminder that in full shoulder flexion, you should be able to make a chicken wing shape with the dog's leg. In some dogs with bulky, well-formed muscles, the muscle may be in the way of making this chicken wing shape. So examination of the right forelimb. So taking the joint, the carpal joint into flexion and extension. And here I want to show you that this dog has a restriction in carpal flexion. And it's actually quite an abrupt end feel. So I'm going to pause the video for a while again. So a bony end field is where bone approximates to bone and the range of motion comes to a hard abrupt stop. So this is what it feels like when I'm examining the carpus of this dog. And this is generally associated with bone remodeling as seen in fracture calluses or osteoarthritis of the joint. Let's go ahead and continue watching the video. So palpating up the radius and ulna again, looking for pain. And then taking the elbow to full flexion and extension. That's pretty good range of motion. The shoulder to flexion and full extension. That's not a problem for this dog. You can see that it's quite relaxed. And now performing a complete bicep stretch with utmost ease. And in our first patient, we can appreciate that the right carpus has reduced range of motion in flexion, and the end feel of the range of motion is described as a bony end feel. But apart from that, this dog has no significant abnormalities in both its forelimbs. Our next patient is also a dog that was hit by a car. This dog has sustained a pelvic fracture and dislocation of its coxofemoral joint on the right hind limb. Here I'm going to demonstrate to you some restrictions of range of motion in its left forelimb. Let's go ahead and watch the video. So taking the elbow into extension. That's a very good elbow extension there. Now taking the shoulder into full flexion. And just popping over to look for pain, a pain response. It's not painful. So in this dog, I can't achieve full shoulder flexion. And this is because its triceps muscles are still in quite good form. And it's called soft tissue approximation and feel, where bulky muscles are going to limit a particular range of motion. And this is a good thing for this dog. We go ahead and perform the clinical examination, taking the limb into a bicep stretch. So you can see that now that I'm stretching out the dog, there is a slightly elastic feeling, limiting the full range of motion. It's nowhere as easy and as comfortable as the other patient that we examined in the former video. Now this is described as a firm end feel. A firm end feel is where there is a firm but slightly yielding stop, and it occurs due to tension in the joint capsule, tendon, ligaments, as well as the myofascia. We continue to watch this video, taking the shoulder into extension. And here as well, you can appreciate the slightly elasticy feel, causing a limitation in shoulder extension. And I'm pointing out to you the stiffness in the myofascial plane of the left forelimb. The last patient we have here is a dog called Camalo. Camalo is a sweetheart. He's been with us for a very long time. He presented with bilateral grade 4 patella luxation. 2 surgeries have been attempted in both stifle joints and both have failed. I want to show you what I found on clinical examination of this dog's forelimb. The first thing that you will see me do here is look for latissimus dorsi trigger points. I want you to take a closer look at these dogs' face when I start palpating the trigger points. So let's go ahead and watch the video. So palpating, you can see that his ears go erect. No pain, no pain, totally not bothered, not painful, not painful. And then I palpate higher up in the lat dorsi and oh, painful, painful. Look at his eyes, painful. He starts contracting everything and turning around to look at me. So this is extremely painful. This dog is so stoic. He's not barking, he's not vocalizing. I can just tell from his face that he's painful. So now examining the dog in lateral recumbency, checking the toes, palpating up the metacarpus, carpal flexion and extension, checking the digits, flexion and extension, palpating up the radius and ulna. I'm going to pause the video for a while. So I want to show you this abnormal flap of skin that becomes obvious. So I don't know if you can see that red dot. I'm going to circle it. Yeah, this abnormal flap of skin that becomes obvious as I extend the elbow. This suggests that there is tension in the connective tissue in this region, perhaps from secondary compensation changes, because this dog does have really severe hind limb pathology, but it also may be remnants of a scar tissue. So you can notice that this dog has discoloration of the skin and the fur around this area. So that may be an old injury, and this dog now has a lot of fibrous connective tissue in this region. So that is actually an abnormal finding. We'll go ahead and watch this video. So taking the elbow now into extension, and here you can feel, or you can appreciate, the elasticy end feel in elbow extension, and this is because the biceps tendon and muscle is actually quite stiff. Taking the limb into full flexion, it's all right. And now taking the shoulder into extension. And that is quite painful for this dog. Does not want to do it. I'm going to pause the video for a while. So when you can't assess the range of motion in a joint because of pain, this is called an empty end feel. Taking the limb into full flexion, and you can see that the dog is painful. So now I'm checking the supraspinatus tendon. Can you see that flick underneath my fingertips? So it actually feels like a guitar string. Usually I appreciate this in the pectineus muscle and tendon, but not so much the supraspinatus. So that's quite severe pathology, and that is why this dog was painful when I was flexing its shoulder, because I'm stretching out the tendon insertion onto the greater tubercle. We'll continue watching this video, checking the digits, palpating up the metacarpus, looking for pain, flexing the digits, extending the digits, flexing the carpus, quite normal range of motion, extending the carpus, palpating up the radius, and then the ulna, taking the elbow joint to flexion, and then extension. So I can achieve better elbow extension. You can appreciate in this dog on the left side. But at the end of the range of motion, it is quite painful because he actually starts licking his lips. So I go ahead and continue to look for trigger points in the triceps. And then I'm taking the shoulder into full extension. And he's fairly comfortable. He allows me to do that. And then I'm taking the shoulder into flexion. Quite comfortable, and it allows me to do that as well. And now performing a bicep stretch, and he's all right with that too. So his face looks still quite relaxed. So in this patient, we can appreciate that range of motion of a joint can be limited by soft tissue tension, which is called capsular or firm end feel. And if it is limited by pain, it is called empty end feel. Now in this video, I want to show you this dog's posture. You could just see from this image even now that his natural posture is to sink in the forelimb. He probably started doing this to take the load off his painful hind limb, so he's compensating by using his forelimbs to walk. And now he has developed shoulder pathology, so it's probably painful for him to fully weight bear on that shoulder, so he's sinking further in that right forelimb. We can also appreciate now that this chronic abnormal posture is causing tension build up in the myofascial planes. So the biceps muscle and tendon is stiff and is now limiting extension of the elbow joint. So that causes him to exaggerate this sinking in the forelimb posture. Let's watch this video. So you can see that he can barely bear full weight in extension of the hind limbs and even in his forelimbs. if we hold his posture upright, he does not want to put any weight on any of those limbs. So this is a video of him walking, and you can see that, you know, it's quite a miracle that he can actually walk, but his posture is so abnormal. He just looks like a hermit crab. Look at that. Sinking into his forelimbs and crouched in his back limbs. And watch him coming back. Alright, so that's the end of this little video presentation. And so for a patient like Kamalo with several failed surgeries, I think a wheelchair is not a bad option for him. So I would probably consider getting him a 4-wheel wheelchair, and he'll probably need also a lot of manual therapy, so heating of his tissues, massaging, and gentle stretching, because obviously, you know, when an animal is tight in its muscle and you stretch it, you force a stretch, that can be a source of pain, and it can be a source of further guarding, which exacerbates the problem. So you want to be quite gentle when performing these manual therapies with these animals. So before we end, I want to take a moment to thank the Soy Dog Foundation in Phuket, Thailand for establishing a state-of-the-art animal shelter and shelter hospital for the street dogs and cats of Thailand. I applaud them for recognizing that rehabilitation is an essential component of helping animals with mobility issues recover. To the Soy Dogs and Cats of Thailand, I want to thank them for being my greatest teacher and making me the clinician that I am today. Last but not least, I want to thank Marlon Krieger and Raymond Gerritsen for helping me take these video footages. A lot of effort has gone into making this happen. I hope you guys enjoyed that and it was useful to you in understanding range of motion and what limits range of motion. Alright, take care. Bye.